And I leave the floor to Cecilia Edström, who will be the moderator for the conversation with Csaba, Degi.
Thank you, Pernilla. Ladies and gentlemen, what a remarkable day we've just had. I'm sure we've all taken away something new. We've all learned something new today that can give us further insight in how we can prevent, diagnose, cure, and not least live with cancer. Cancer touches the lives of millions of individuals across the world, both those directly affected, but also their families, relatives, colleagues, and civil society. Survival rates have improved drastically over the years, and cancer is more and more regarded as a chronic disease that you can live with for many years. But how does that impact your quality of life? Our closing session today on Mental Health Day has the powerful caption, Cancer and Mental Health, Body and Brain Combined. And we have the privilege of hearing from a distinguished expert who's dedicated his entire career to enhancing the well-being of those affected by cancer. Dr. Csaba Degi. Hello, Csaba. Nice to see you.
Hello, Cecilia. Hello, everyone.
Very welcome. He's not only a professor, but also an esteemed researcher at the Babe Bolea University in Romania. But he's also a licensed social worker with a private practice. He has a PhD in medical psychology and has dedicated over 2 decades to supporting cancer patients, collaborating with healthcare professionals and advocating for improvements in oncology care. As Pernilla rightly said, he's the president-elect of the European Cancer Organization, ECHO, in Brussels, and also serves as executive secretary of the International Psycho-Oncology Society. His insights have found their ways into esteemed publication, but I think perhaps even more importantly, beyond academia, Dr. Degi has developed a distress screening app for patients. Today, Dr. Degi will highlight the interaction between cancer and mental health, focusing on the experiences, resilience, and well-being of individuals who face this challenge. So, ladies and gentlemen, we will shift our focus from the disease narrative to the people it affects, to understand the holistic journey of cancer survivors, patients, as well as their families. Welcome, Csaba. The floor is all yours.
Thank you so much, Cecilia. Well, I am more than honored to be with you. I followed the day from Utrecht, and I, of course, missed Stockholm, but in the end, it's a World Mental Health Day. So I think we have the same mission, the same vibe, and I think this day it's really about, the question of should we celebrate or not, or should we do something else? So I will try to have 10 minutes of closing remarks. And then, of course, we are more than happy to collaborate and to go on, as I just heard from Mike Morrissey, because the 4th pillar, it's a treasure to be discovered. Still, the 4th pillar of the Europe's Beating Cancer Plan on survivorship and quality of life. So, first of all, I think mental health starts with a very good life expectancy at birth. And Sweden has it all, right? So if we take a look at the average life expectancy at birth, we can see that in the last decade it was stable, and it's above 80 years, both for women, both for men, for boys and girls, right? And I think this is a very good starting point that we never should forget about, right? It's like the zip code in the United States. And also, if we ask the Swedish self-rated health, we can see that a very high majority of the persons rate their health as good or very good. But of course, it doesn't matter what do you mean by health, because probably here we see a self-rated physical health. And in the next slide, we are going to see something quite curious. We see that the percentage of adults who stated that mental health is the biggest health problem facing people in their country has the highest percentage in Sweden, according to a quite recent data from IPOS. And on a global level, in Sweden, it's 63%. So it doesn't matter what do you ask and what do you mean by health, because of course there is no health without mental health. Also, if we go into the specifics of the mental health issues, we can see that most of them are around the area of tiredness, anxiety, insomnia, sleeping issues, stress-related issues, and less about depression and suicidal thoughts. And of course, if we look more into depth about the specifics, we can see the difference between men and women. But again, this is the big picture that we have when we go into the mental health worries and the mental health challenges that we just screened with this global tool. One of the very specific group of people are the people aged 65 and above, because as we all know, many of the cancers are having a risk factor related to age, and also because age is a very important element, because you cannot change age, at least for now we cannot change. And in cancer care, it's sometimes quite a risk factor, an important demographic risk factor. So if we see the share of adults with mental health in Sweden, aged 65 and older, we can see that this is rather a low level compared to the other places in the world. And also, more than specific, the share of this group with mental health needs who report having cost-related access problems, which is around 6%, the lowest in the world, together with Germany. But still, cancer, it's not a solo issue. Cecilia just made it very clear that the premise of cancer care, it's the family business. So cancer is indeed a family business, and it's nice to look at the survival rates from Sweden. They are full of hope for many places in Europe who don't have this kind of data and this kind of success related to 5-year survival rate, as you can see here, which is increasing very nicely in Sweden in the last decades, and it's quite high. But when we are talking about survivorship, again, we are talking about a family business. Also in Sweden and Denmark, we can see that the spouses of patients with cancer actually have a higher prevalence of mental illnesses, including psychiatric disorders, such as depression, anxiety, compared to the patients with cancer. This is quite a news. It's published in 2023. And again, cancer is a family business. So when we are talking about mental health, we should include the caregivers and the caregivership. Even though cancer survivorship rates are very high in Sweden, the mental burden, the psychiatric burden, it's there, and especially for caregivers. Just a few thoughts about the burden and the impact of caregivership. I can tell you that the physical and mental health trajectories of both the patients and the caregivers are showing the impact after the moment of diagnosis for 2 years, 5 years, even 8 years, caregivers' physical health declined among those reporting low level of mental at the moment of the diagnosis. And also for those patients who reported low physical health at the diagnosis. So poor mental health at the most important moment, at the moment of the diagnosis, is a significant risk to the physical health of the caregivers. And yes, it does matter what kind of personality, what kind of attachment style has the caregiver, because anxious caregivers actually are more prone to chronic grief and impairment. So because of their fear of abandonment, they are actually insensitive caregivers, and so they are actually piling up the burden in the caregivership process. And then only caregivers higher depressive symptoms predicted their decline in physical health 2 and 8 years after the patient's diagnosis. So caregivership, it's not an issue of the moment. It's not an instant story. It's a long-term story. And it impacts the mental health and the quality of life 5 and 8 years post the diagnosis. This is very serious. It happens even when the family members are dying. So even after the loss and after 8 years, the initial diagnosis, poor mental health is still present in the caregivers. This is extensive and longitudinal research by Professor Kim Young-mi from Miami and her team. And these evidences are quite shocking because, again, cancer, it's a family business. And patients with severe mental disorders, depression, dementia, and substance use disorder, they have significantly worse survival after cancer diagnosis, even if we exclude the stage of the diagnosis and other well-known co-founders in the statistical analysis. This was published quite recently, so we have to tackle and to understand more about this burden, because it really has a toll on all of us. And there is some good news. Getting mental health treatment. Yes, treatment in a very, very broad way may help people with cancer who also have a mental health disorder live longer. This was also published in Psycho-Oncology recently. So there is hope for something, at least in the cancer care, if we include the fourth pillar. And coming back a little bit to the question that I asked in the beginning, should we celebrate? I am not so sure, because we are living in a world where people find mental health and cancer one of the biggest or two of the biggest health problems after COVID and, the pandemic that Mike extended it as the biggest unexpected risk of the last years. That's true. But after COVID, mental health and cancer is really top 3 high on the agenda. So, and adding to this fact, the thing that in cancer care, mental health is probably the most underrated, undiagnosed, and unrecognized need of all. So I don't think it's a moment to celebrate. But certainly, it's a moment for us to ask another question. Can I make a difference? Can we make a difference? Because I think this is the real question. And I think there is some progress in raising awareness. Wow, social media and politicians were really full with mental health priorities today, which is good. And this is reducing stigma also. But we need to continue to invest in mental health. And we need to continue in creating supportive environments. As you have seen, even Sweden, it's one of a kind. It's really a jewelry in many senses related to healthcare and cancer care. But still, mental health, it's a challenge. So, yes, the real question is if we can make a difference. And yes, we all can make a difference in the fight against mental health problems. And one of the ways is that mental health is also online and should be online as well. So let's make a difference together. Thank you very much.
Thank you very much, Csaba, for that inspiring talk. I think there's hope. There's a lot of hope put on technology these days. And how do you view technology and how that can play a role in providing psychosocial support? I was thinking about your distress app and other applications.
What a great question. I think that the way we try to fix our distress when we have cancer, it's like when we are walking up a very long and tiring set of stairs in a very beautiful or not so beautiful city. You just try to walk up these big stairs, and there's some things that help you stepping on the first stairs. Maybe you have a good pair of shoes, and then there is something that can help you in the middle of the stairs. After 80 stairs that you have taken, steps you have taken up, maybe a drink of a good water or vitamin water or whatever can help you. And maybe somewhere, when you are very close to the end of the stairs, maybe some help from your friends, someone can hold your hand. But also on all this level of the stairs, you can just have something like a smartwatch, or you can have something like a passive monitoring, or you can have something that really understands what is happening inside of you and what is happening with you. So the idea, what I want to say is that certainly all the technologies, digital technologies, e-health, AI, however we call them, are very close to us, because basic psychological needs are very easy to be tackled with, some of the techniques that can be digitalized. And yes, this is one of the things that creators of AI tried along the way, that technology should be very human and more human. So even when in the 70s, there was, just a little flame of the AI research, they already started, mathematicians, they already started making the ELISA robot. ELISA was based on the person-centered approach of Carl Rogers, a very well-known psychologist. And yes, technology, it's very human-like, we should use it, and our patients are not afraid to use it, because just it's very complicated, and think about the stairs like a very complex, comprehensive cancer care institution. Make this mental switch, and you will understand how the best surgeon, the best doctors, nurses, social workers, psychologists, caregivers, they all have a place when you walk up the stairs of this cancer institution. And yes, technology included. Technology, it's very human-like. And actually the AI that we are, just having on the menu, it's actually, trained on all our civilization and all our human knowledge. So I don't think that's something it's very different. And I don't think that it's far away from the way the human psyche, it's actually trying to understand the world and to feel safe in the world and safe enough to discover this world. So I'm very hopeful about this. And, I do remember when I started as a researcher, patients were in the afternoon in their beds watching TV, and as the years went on, they were not watching TV anymore in the hospital. They were on their phones. Yeah. This is how we discovered that in Romania, At the time, 20 years ago, we didn't have psycho-oncologists, nothing about psychosocial. But we discovered that patients, almost everyone had a phone. So let's give them an app, because the app, it's a kind of feedback and it's also a kind of self-help instrument. So, and AI is even stronger than just a basic app with functionalities. So
in one of
patients
the
are very-
previous, in one of the previous panels, we were talking about the gender inequality, and that the support group and support systems are more accessible to women, and they're set up in a way that cater better to women than to men. At least that's my interpretation of it. Do you see that AI and technology can actually help bridge that gap and make it more tailored to the person rather than a sex or a certain ethnical group?
Certainly, there is a way that is going to change all these gaps. I am not sure that technology has a promise to delete or make these gaps, unreal or not present. But certainly, we should try everything, because the gaps have a very high pay and the price that we pay. So all these gaps and inequalities, gender inequalities, all the kind of, yes, it's very important. Just take the example of the breast cancer. Men and women also have breast cancer. And take a look at the data of mortality for breast cancer in women and breast cancer in men. So it's quite shocking. One of the things that we could, do it much better, actually. Yeah.
Yeah, thank you. I'm going to see if there's one or two possibly questions from the audience before I wrap up. No? Then I'm going to ask you a final question. So in your role as president-elect of the European Cancer Organization, what are your key challenges in making cancer care comprehensive and bringing in both the body and the mind?
Yeah, there is no way out. I just listened to Stella Kyriakides this morning, and she said, and I was smiling all the morning, because she said, we need comprehensive mental health care. Perfect, because comprehensive cancer care and comprehensive mental care are just really good to go together. So I'm very hopeful that is going to pave the way for European Cancer Survivorship Day. We really need that, because we have 20 millions or around 20 millions of survivors, cancer survivors in Europe, and they have their needs and their voice. So I do hope that together we are going to make it happen and to have it. It's one of the goals of my presidency, to be comprehensive and inclusive in cancer care. And that also means to have the survivorship needs and the people who survive cancer in a very, very, very close and very strong hold. So I do hope we are going to celebrate in 2 years the European Cancer Survivorship Day, which is going to be more than just hope. It's going to be a step forward. And the second thing that I am very, very keen on, it's actually the way we meet with all the other regions of the world. For the start, probably the American and European cancer policy getting together closer and closer, because all regions of the world are actually having some kind of solutions to the cancer issue and the cancer problem. So I think that's one of the good things that we are going to see as a result in the next 2 years of our presidency and working together. So I strongly believe in this cancer policy, getting a worldwide view.
So if I summarize that in just a few words, I think what I heard you say is that it's not only about preserving life, it's also about restoring and preserving quality of life of the survivors of cancer. And I think that's equally important.
Yes, Cecilia, this is indeed the fact. There is a fine line, a difference between surviving and thriving, and mental health makes most of this difference, actually.
Thank you very much, Csaba, and best of luck in your important work. I'm sure it will benefit all of us, so best of luck with that. And with that, I hand over to Pernilla to close the day. Thank you.